So for prep of an art line, make sure you open the tray away. This has your catheter, your needle, but it does not include a small subcutaneous needle for anesthetizing. So typically I'll ask for a 22 gauge syringe. For femoral arterial access, I do again prefer microcatheter, just for simplicity of placement in case you were to make a high puncture site. So within the kit itself, you have your catheter, you have your introducer needle, and then you have your guide wire. So again, you want to remember your anatomy, that the artery is lateral, and you want to follow your needle down as you're anesthetizing, holding negative pressure as you go. Once you have adequate lidocaine injected, you can come back. And since we are arterial now, you do not need a plunger. You just go in with the needle. So find your vessel where you entered the skin for the injection, and then simply follow your needle down, ideally at a 45-degree angle. Into the artery. Once you have blood flow back, there are two approaches. One is some individuals will keep the ultrasound there to fix it. Otherwise, you can drop your ultrasound and fix it with your hand. Particularly if the patient has a thick body habitus, it can be helpful to keep the ultrasound probe where it is. Once you have threaded your micro needle through, you're going to come back with your needle, leaving the wire in place. Confirm placement of your wire. You can insert your arterial catheter in a twisting motion. You do not typically have to make a nick when using a micropuncture, at least initially. Once you have your arterial line in place, typically what I will do is I will suture in at least one side, mostly because once you let go of your catheter and try to hook it up, it has a tendency to pull a little bit. So by suturing one side in, it secures it to the patient. Then I will remove the wire. Typically, you'll have the pressure line hooked up already by nursing staff or staff in the room. You'll have them hand you the pressure line and you'll hook up and confirm arterial placement. You finish by suturing in the other side and then placing appropriate sterile dressings on top.